Good afternoon, everyone. Welcome to today's SVS VQI Updates and Registry Revision webinar. My name is Jennifer Correa. I'm the Marketing Manager here at the SVS PSO, and I'm joined today by our presenter, Carolyn Morgan, SVS PSO Director of Clinical Operations, and other members of our PSO team behind the scenes. Before I turn things over to Carolyn, I do want to cover a few brief housekeeping items before we get started. We will try to keep all lines muted throughout today's presentation, but we do encourage you to type any questions you may have in the Zoom Q&A box. This will allow us the opportunity to answer questions as time allows at the end of this presentation. In the event that we are not able to answer your question live during the session, we will reach out to you via email following the webinar. And with that, I'll turn things over to you, Carolyn.
Thank you, Jen. Happy holidays, Merry Christmas, Happy Hanukkah, to everybody. Thank you for joining today. I just want to go over some registry revisions, talk about some offerings that are in the Pathways platform, and then provide a few updates. So hopefully this won't take up too much of your day, and hopefully you'll find it helpful. So today's agenda, the first thing we're going to talk about are our real-time reporting offerings. We're going to talk about registry revisions and then hot off the press updates. So just to remind everybody, I'm sure all of you as data managers are aware of this, but if we can try, we're going to try multiple different avenues to get the word out to some of our physicians and attendings. The PSO VQI, through the Pathways platform, offer two real-time reports. One real-time report for procedures and one-time real report for follow-up outcomes. These reports are refreshed nightly, every day, whether it's a holiday or whether it's a weekend. So if data is entered in today, when you get up in the morning, if you log in, that data should, unless something happened overnight, should be in these reports. So first for the interactive dashboards. Again, these interactive dashboards right now very much mirror our quarterly best practice reports. So an example, I have two examples here. One is for the carotid artery stent interactive dashboard, and the other one is for the TVAR complex EVAR interactive dashboard. I do want to just emphasize that this is the very first release of these dashboards. And since we've gotten them all out now, beginning in 2026, the analytics team from the PSO will be upgrading them. Maybe more graphs, more risk adjusted within these dashboards, more filters. So stay tuned. They are going to continue to be enhanced on a rolling basis. But right now, with the carotid artery stent interactive dashboard, you can filter by procedure type, whether it be TFEM or TCAR. You can filter by indication, asymptomatic or symptomatic, and then pick any date range that you want. Within the TVAR registry right now, you're able to filter whether it was a TVAR or whether it was a complex EVAR, because as all of you know, these complex EVARs are more complicated. Now, I can promise you that right now, TVAR includes the arch work. So we have some work to add some additional filters to what I would like to see is it filtered by zone. We filter currently right now by urgency, by pathology, by your presentation, and again, by the procedure date of treatment. The interactive dashboard for open aorta, it is brand new. We were able to start this one from ground zero. So for the interactive dashboard for open aorta, we provide filters for your urgency, your pathology, and here, the zones of treatment. You can pick any range of zone of treatment that you want, as well as your procedure date. Moving on to the follow-up outcome reports, these are two examples of your follow-up outcomes. And we don't say long-term follow-up outcomes because you can filter by 30-day follow-up. You can filter by whatever range you want for your procedure dates. For PVI, we provide filters for performance site, your leg symptoms, Rutherford 1, 2, or 3. Was it Rutherford 5, rest pain, critical limb ischemia, acute limb ischemia? Then we also provide filters for what artery was treated. SFA, SFA pop, iliacs, things like that. And then your treatment types, stent, stent graft, atherectomy, and the list goes on. So that should be a very valuable tool for you as centers. And we're hoping to, again, continue to enhance these, potentially provide risk adjusted, which I say potentially just because I don't want to put words in our analyst's mouth, but I know that they've been talking about it. Maybe some graphs, maybe more filters. So more to come. Within the TVAR follow-up outcome report, again, filter by date, filter by your presentation, your pathology, the dissection indication, and then your zone of treatment. So hopefully these two reports will provide some value to you, your center, your C-suite, or your vascular surgeons. We wanted to provide you the most current updated VQI reporting schedule, which is on the left-hand side of the screen. On the right-hand side at the very top, I've also provided the link so that you can have it handy if you ever want to update your own reporting schedule. As the last quarter falls off, a new quarter will be added at the bottom. I want to note that beginning in spring of 2026, there will be a smoking cessation counseling report. You can see that indicated with the red arrows pointing to it. And then just note that the VQI quarterly best practice dashboards are in the process of being transitioned just to the VQI interactive dashboards that are available in Pathways. Once this is complete, these reports, these quarterly reports, will be retired, and we will be providing you more information and updates as they are available to us. So wanted to just make sure that all of you were aware, maybe some of you weren't in the office, I believe it was last week, but Betsy provided a CVQI points and annual review of your participation points for quality improvement. She talked about the CVQIA points in the introduction of the National Quality Initiative for Smoking Cessation as a bonus point in 2026. There were two links provided here. One is for the YouTube video, and the second link is for the slides. Again, this is the annual webinar that Betsy always provides, but within this webinar, she also introduced a smoking cessation bonus point. And then I took a snippet of the above reporting schedule, blew it up a little bit so that you can see that in spring 2026, your smoking cessation counseling report will be available for quarter 1, quarter 2, and quarter 3. And remember, this is a rolling report. So once the fall 2025 rolls off, a new report will roll back on. So tomorrow, for all those centers that are in the TVAR registry, you will find that the TVAR registry now has cloning. You can clone between TVAR procedures. For the demographic variables that are provided in PVI, Infra, and Supra, those will also now be offered in TVAR as well. And then there will be some additional specific targeted TVAR variables that are specific to TVAR. And I just want to remind everybody that the variable selection was made by the TVAR committee. And they took a lot of time and were very thoughtful about what variables. It's a slim list right now. It's only about 6 variables, but um, it's a start, and I anticipate that it will expand. So right now, these are the variables: your prior aortic surgery, your prior aortic surgery location, ejection fraction, TEVAR pathology, aberrant aortic arch anatomy, and genetic history. And each of these variables have a time frame associated. So for instance, ejection fraction, you can only clone it if it's within if the first procedure and the second procedure are within 60 days of each other. So there is a quick reference guide within Pathways. If you are not familiar with the cloning process, if you go into your support tab, go down to resources, and then look for a document titled Quick Reference Guide, Registry Clone Procedure. We also want to make sure that you know within Pathways, there is a short video that talks about cloning. They are going to rename this to include TVAR now, but the video is 2 minutes and 49 seconds. So it should be a really good resource. It shouldn't take up too much time if you have someone maybe new that is new to your center and starting to do data abstraction. This might be a helpful tool for anybody, or just a refresher for some of the more seasoned people. So for registry updates, starting tomorrow, you will notice that there was introduced into all the registries registry numeric value hard stops. In the past, if a numeric value was entered in that was outside of the minimum maximum range, you would receive a warning, but you were still able to submit the form. Moving forward, because we have heard from our data analysts and actually called out by some of our centers that VQI is allowing erroneous data into the registries, that if a value is entered in that is outside of the min-max range, you will be requested to either correct the error or submit it blank. Now, we are getting some feedback from some centers, particularly around toe pressure, that the toe pressure values need to be adjusted, and we will adjust those. But for now, this is what it's going to be. And for the most part, I'm not going to say 100%, but for the most part, I think that these min-max values are very generous. If someone has a creatinine of 15, most of the time they're on, I haven't seen anybody with a creatinine of 15 that isn't on dialysis. There might be a rare case out there, but for the most part, I think these minimum maximum range values that have been provided by our committee members are pretty spot on. But if not, we will take it back to the committee and make the necessary adjustments. This is something that is brand new, that this will be the very first time anybody hears about it. We're going to be doing a lot of education on it, and it will be part of the Q1 2026 help text revision. So within the long-term follow-up, EVAR, TVAR, sac diameter, from as long as I've known, so it might be since the beginning, since the registries were launched, imaging for your long-term follow-up, sac diameter, you had to put a numeric value in there. And if there was no numeric value provided, for instance, maybe the radiologist dictated that there was no change, or maybe the sac diameter is stable, the instruction or education provided to a data manager was always, please go back to the attending or provider to get the exact number. Moving forward, And remember, imaging needs to be within 9 to 21 months after the date of the procedure. But moving forward, if follow-up imaging is available and the interpreting clinician documents the max aortic diameter is unchanged, is stable, it's the same, any type of any type of similar word, without providing a numeric measurement, we are asking that you just go back to the most recent prior documented max aortic diameter and enter that value into the long-term follow-up form. Hopefully, this will make it easier for you, but it will also allow you to complete the variable and submit it so that you don't get counted against for your long-term follow-up completion rates. So for the help text revisions within EVAR, the Amplatzer plug never had a definition or help text, so a help text was added for Amplatzer plug. There was clarification on your EVAR, TVAR, and Supra ICU days before it was any portion of 24 hours. But this now has been clarified to include total number of days the patient received care in the ICU, regardless of transfer status. And then for the TVAR complex EVAR total procedure time, we historically have always just said from incision or initial sheath placement. We added some verbiage that whichever comes first until closure or sheath removal, whichever comes last. If there is concomitant procedures that occur, please add that in the comment box. Apparently, it sounds like now sometimes people are doing TVARs and TAVRs, TVARs and cabbages, a number of different combinations, but we are still going to go with total procedure time. And if it is a concomitant procedure, add the comment in the comment box until the registry is up for revision. And it'll be at that time that we will make the changes to add more concomitant procedures. So SVS VQI has done an automated data abstraction webinar and recording. We wanted to provide you the YouTube link to that, as well as the slides and supporting documents. So these are the links for those. These are really, really helpful. There are a number of different pathways that FIVOS is offering for automated data abstraction. I do want to share with you, and I've talked about this a lot, and I apologize for repeating myself, but there might be people on the call that haven't heard this before. But I am going to try moving forward as much as reasonably possible, unless it's something that needs to happen quickly. The first quarter of each new year will be a major registry revision. It might slide into quarter two, but for the most part, it's going to be within the January, February, March, April timeframe. We're going to try to give centers at least 1 month notice, as well as a draft document of the help text that will tell you which variables have been changed and how they've been changed. And then the second half of the year, we're going to try to do the across registry revisions. Those might be some more continued harmonization across registries. It might be a little bit of cleanup work within one registry or another, but I'm going to try to minimize what I call one-offs within the registries to once a year, because once we get into our automated data abstraction, I don't want to do it too often because that'll break whatever coding is already in place. I do want to reassure everybody. I've had multiple discussions with the SVS PSO leadership regarding harmonization of the demographics across all of the registries to make sure that all the variables are in the same place, all of them are in the same order. The decision has been made that as registries are going through a major revision, that is the time that that will happen. Unless, for instance, like when we did the antiplatelets, we did it all at one time. When we did the chronic anticoagulants, we did them all at one time. But for the most part, we're going to be doing those with the major registry revisions. I can tell you that CEA and CAS are going to be the next. Well, first of all, lower extremity amputation, we are slated and still on track to release Q1 of 2026 with a major revision. We have taken it from its original offering, which was in 2009. You still had the general tab, things were not in the same order. That has been all updated to align with the InfraSuper registries and the open aorta registry. 2026 Q2, Melissa and I are going to start working on the carotid endarterectomy and carotid artery stent to do harmonization as much as we can for demographics and the history tab, so that the collection of stroke and TIA is the same within both registries. The imaging is the same. I'm going to lobby hard to get rid of some of the ultrasound variables, like I'm just your ultrasound variables. I'm not going to get into all the different ones, but I'm going to lobby hard to see if we can minimize those and only report on the ones that are most meaningful. I'm also going to do a deeper analysis to look at missingness to help support the fact that maybe we shouldn't be collecting this anymore because there's such a high level of messiness for those variables. But I hear you. I would love to be able to do it all at one time, but it has been decided that it will be done with the on a registry by registry basis with the major registry revisions. And with that, we can open it up for questions.
Okay, so our first question kind of goes back to reports, and I think this one would probably be best answered by Pathways support because they could tell you exactly where it is. But is there functionality of being able to download PrimProc IDs available? I'm not able to find it to download.
So if you click on whatever variable you're interested in, let's say it's adverse events or complications, whatever it's called. If you click on that, it will provide you a list of the PrimProcs. Those PrimProc numbers are provided in a column, and then you can click on each PrimProc. Eventually, and Jeff Yoder is starting to work on this for the interactive procedural dashboards. He's actually starting to provide some additional detail and columns within all of those.
So there's a question about the ranges for packs of red blood cells for the aorta registry. The person often has to enter 70 to 80 units and once had to enter 180. So is that a field that you could look at for expanding the range?
Absolutely. Absolutely. Oh, and I will share with you that the Cell Saver, not the Cell Saver, estimated blood loss for EVAR TVAR has been updated. That between the two registries, first of all, it wasn't harmonized. It has now been harmonized. And the estimated blood loss is between, I want to say, now 1 milliliter and 1,000 milliliters. I've had some feedback from some centers that say, well, my physician says that there was no blood loss. And I will counter that by saying, I don't know of any arterial access when you put your micropuncture needle in there, your Seldinger needle, whatever, into an artery to place a sheath, there's always arterial spurt or some arterial blood that comes out of the needle. That's how you know you're in the artery. So if someone, we are providing education that if there was dictation that there was no blood loss, to just enter 1.
And then there's a thank you for all these updates. People are very appreciative of them. And then there's a question, have we looked at allowing older scans greater than 6 months that people are often using quote unquote old scans and they can't enter them?
We just recently talked about this within the last 4 weeks. And right now, leadership and even the Arterial Quality Council feel that if if it is a patient that is going in for a procedure and they haven't had an updated report 6 months prior to their procedure, they don't think that's within standards. And for long-term follow-up, the same. If I know that there have been we talked about this where there was a center that had a long-term follow-up that was done, or maybe I know it was a preoperative scan that was done 7 months before the procedure instead of 6 months before the procedure. I don't know that we will ever make everybody happy. So all I can offer is to put your imaging information in the comment box and leave that particular variable blank. We will continue to gather that information if you put it in the comment box. There are times when we intermittently go through and look at all the comments and then take it back to the committees and the Arterial Council for discussion.
Is there any way to data download cases without the variable used only in research? Some of the centers participate in research and others do not.
So I can tell you that in 2026, FIVOS is going to be they're getting rid of what is currently in the data analytics tab and upgrading it. And I have seen a really quick, rough draft of the capability of these new reports, and I believe yes.
So someone says for the CAS cases, they're frequently coming across karma, I can't speak today, KERMA or DAP that are lower than the allowed amounts. So now they would leave it blank and submit without validation. Are we going to look at lowering these ranges?
Sure, I'm
Uh,
right.
yep,
Yes.
yes. So that's it. So anytime if you routinely are seeing that there are ranges that aren't not appropriate, or that you're finding that your cases are outside the range, if you submit a update request with FIVOS, we do get those on a routine basis to review.
And so far right now, I have the DAP and the air karma as well as toe pressure. We've received some feedback that toe pressure needs to be expanded, particularly the maximum range. So that's on my list so far.
Can you put not documented as a choice for estimated blood loss?
I, I can take it back to the committees. Um, I I'll have to get back to you and add that as a enhancement request.
Will the data definition document be provided with these registry revisions?
Yes.
Yeah. Is there any, yeah, so the answer to this is yes, and I see that Dawn's on here and she might want to speak to this. Is there any course available for new abstractors to assist in the expansion of the VQI abstraction?
Hi guys. Yeah, so we do have the Pathways 101, 102 training videos. Those are up in the support tab of Pathways that give you all of the information a new staff member would need in order to learn the functionality of Pathways and how to navigate. And then on, I believe it's a members only, right, Carolyn? We also have a number of abstraction videos that Carolyn has worked on to help provide some guidance on some of the clinical details of those registries as well.
Okay. Can
Oh,
there be,
let me,
sorry.
1 second.
Yep.
Look at what I'm doing here. So if you go over here, you log in, you go into your support tab, there's a video library. So if you click on the video library, there are a number of offerings here. You have your Pathways 101, which talks about introduction. You have your follow-up and data management tools. You have some reportings. There are a number of different recordings here. And if you need some additional help, Dawn, is it inappropriate for me to say just reach out and Pathways will see what they can do to help you?
Yeah, absolutely. Reach out to Pathway Support at 50health.com, and we have a whole team that are eager to help you.
Okay. Can there be added change in medications at the discharge section of all modules? So any requests you guys have for updates or enhancements, please let Pathway Support know what they are. They're great on this call, and Carolyn and I always make a note. But sometimes it's better when we get the list, we have a volume that like 5 people requested it versus just on the call. So please, any enhancements, please reach out to Pathway Support. The Data Analytics tab to create individual reports will be retired, question.
Dawn?
Yeah, so no panic yet. It will be changed. I don't know exactly how the final look and feel will be when we come out with the new product next year. But we understand how valuable those custom reports are. And so, we're not going to get rid of that. We're looking to augment that and make it even more accessible and more efficient for you to use. So I look forward to sharing more about it as we continue our development efforts.
And Dawn, it's on a newer platform, so it should be more nimble. What I saw was
Yep.
way early on, and it looks pretty amazing. And it's so easy to use. If I can figure it out, anybody can.
So just to be clear, if a result falls outside your preset range, we are to leave it blank, or do we just put the high or low number range in the field?
We would like it to be, according to leadership, left blank and send a note to Pathway Support, or you can send it to me, C. Morgan, at svspso.org, and I'll add it to my list and we'll make the adjustments. We're not going to leave you always leaving things blank. We're going to try to make the adjustments if leadership and our committees agree with the ranges that I present.
And that's all our questions for now.
Well, you guys know how to get a hold of me. I hope all of you can take some time off during the holidays, enjoy your family and friends, relax a little bit, eat a lot of good food, a lot of good sweets, and let me know if there's anything I can do at any time. Happy holidays and thank you all. Take care.